Hello, everyone, and welcome to HLTHPS007, Administer and Monitor Medication. Acknowledgement of Country. In the spirit of reconciliation, Meditech Training College acknowledges the traditional custodians of the country throughout Australia and their connection to land, sea, and community. We pay our respects to the elders, past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Island people today. The objectives for this presentation include confirm delegating health practitioners or professionals authority to proceed with delegation of medication administration according to the organization's policy, guidelines, procedures, jurisdictional, um, legislative, and also regulative requirements. Confirm our role or clarify our role, limitations in providing assistance with medication administration with the delegated health professional. Check that all equipment, including those administering aids, are complete, ready for use, up to date, and tamper free before proceeding. Follow infection control procedures. Confirm medication administration route and procedure. Confirm purpose and function of prescribed medication from care plan and delegating health professionals. Accurately calculate medication dosage according to the authorized documented request. Finally, 2.8, prepare medications according to delegated rule in line with the legal and environmental guidelines. Confirm delegating health professionals authority to proceed with delegation of medication administration. Whenever you need to administer medication, you need to refer to instructions. Here are ways you can confirm the delegating professionals authority. First of all, you need to check the list of delegated health professionals and their roles and responsibility. You also need to familiarize yourself with the roles and responsibility as well as the reporting lines in the organization. Finally, you have to refer to the documentation such as medication charts. These instructions need to be confirmed and you need to confirm the authority of the delegating health practitioner. Requirements when confirming the authority of the health practitioner, you need to abide by the organization requirements. These requirements include the organizational policies, guidelines, procedures, and also legislation and requirements. Organizational policies, these are policies that state the organization's intention to achieve outcomes. These policies and procedures may provide information on which health practitioner has the authority to delegate. Organizations guidelines, these guidelines are not required but advise employees on how to perform their best practices. However, your organization might have guidelines you need to follow on top of the industry and government guidelines. Legislative requirements involve laws, acts, permits, ordinance, and regulatory policies. Regulatory requirements are part of the legislative requirements, and this legislation refers to the legislative policies that help ensure compliance with legislative requirements. In this context, the requirements are established to safeguard the welfare of health consumers. There are many legislative and regulatory requirements in place. The following are legislative requirements. We have the Therapeutic Goods Act in 1989. This legislation varies from states and territories of Australia. These are laws written to ensure the safety of people as they provide restrictions on prescription, distribution, and use of drugs and poisons. Now, the Poison Standard February 2022 is a legislative instrument made under the Therapeutic Goods Act in 1989. You can refer to subchapter 1.5 for more information on this standard. Clarify our role and limitation in medication administration. Now, these roles include assessment, preparation, administration, monitoring, and education, which we'll talk about in the following presentations. However, the limitations include operating within the scope of practice, which may vary depending on the local regulations and organization's policy. We do not make medication decisions beyond our training or expertise, such as altering medication dosage or schedules without proper authorization. We refrain from administering complex medications or procedures that require specialized training or qualifications. We do not attempt to manage medication emergencies beyond our training level and should seek immediate assistance when needed. Finally, legal and ethical consideration. We need to be aware of those considerations surrounding medication administrations, which include confidentiality and also informed consent. Check all medication related equipment before administration. So, these equipment include Webster pack, PPE, such as aprons and gloves, lubricants, measuring cups, and so on. Before proceeding or before administering medication, you need to check that those equipment have the following characteristics. They need to be complete, ready for use, up to date, and tamper-free. Following infection control procedures. Infection control procedures are set and series of actions taken to prevent the transmission of infectious pathogens. The standard precautions are infection control practices that can be employed or can be used during day-to-day tasks. These are correct hand wash techniques, hand washing technique, the correct hand washing techniques, glove usage, infection transmission awareness to prevent cross infections. This include droplets, skin, bodily fluid, aerosol, and others. How to follow infection control procedures. You need to be familiar with the standards and additional precautions. You need to educate the client about standard precautions, and you also need to know when to apply additional precautions. Confirm medication um, administration routes and procedures. You need to confirm this route when administering medications, and you can refer to the document signed by the medical officer or the delegating health practitioner or professional. You need to be acquainted with the right route and also the right procedures for that route. Administering medication through the wrong route can have serious and fatal consequences. There are different types of routes. We have the oral, which is through the mouth. We have the oral, which sounds the same as the oral, but this is through the ears and also the eardrops to relieve inflammation and infection. We have the sublingual and the buccal. Sublingual is under the tongue, and the buccal is between the gums and the cheek. We have the intranasal, which is sprayed in the nose, and the nasal membranes absorb the the drop or the spray. Um, the spray, not the drop. Sorry. The ocular is given or administered through the eyes. Inhalant is administered through the mouth, or it's medication that's given through the mouth and breathed into the lungs. And nebulizer is through the nose and breathed through the lungs. We also have the topical medication or transdermal, which is absorbed through the skin. We have rectal and suppositories, which are injected through the rectum or anus. We have subcutaneous injections, which are given through the skin or into the skin below the epidermis and the dermis. And we also have vaginal medications, which are given through the through the vagina. Sorry, and this can be solutions, tablets, creams, gels, or rings. Confirm purpose and function of prescribed medication. Purpose is the objectives of something, and function is the role of something. We need to know and understand the purpose and functions of medications and the basic pharmacology. So we have the pharmacology, we have pharmacotherapeutics, we have toxicology, we have pharmacokinetics, and pharmacodynamics. Body systems are groups of organs with similar purpose or functions, which include the nervous system, which has to do with the brain, and the central nervous system and peripheral nervous system. We have musculoskeletal system, which involves the muscles and the skeletons. We have the endocrine system, which is the hormones which communicate in the body. We have the cardiovascular system, which is the heart and the blood vessels. We have the respiratory system. This is a system responsible for gas exchange between the body and its environment. We have the gastrointestinal system, which is a system that breaks down the food you eat, distributes the nutrients, and absorbs nutrients in the body. We also have the renal and urinary system, which eliminates waste from the body. We have the reproductive system, which is a system and gland involved in reproducing offspring. We have immune system, which protects the body from germs. We have the skin, the intercromatory system. We have the eyes, ears, and special senses. The following are types of medication groups, the key aspects and the general effects on the body system and typical disorder that you may encounter. We have analgesics, we have prescription medication, we have opioids, we have supplements, depressants, and stimulants. How to confirm the purpose and functions of prescribed medications. You need to carefully read the appropriate documents. You need to take note of the medication's name, take note of the purpose and function of the medication from these documents. You need to check the functions of commonly used medications. You need to refer to the advice of the delegating health practitioner, confirm medication plan and reputable source websites if you're familiar with the medication. You need to also clarify any medication jargon with the delegating health practitioner or professional and never administer medication without full understanding of that purpose, of the medication's purpose and function. Accurately calculating medication dose. Now, the oral medications are usually in capsules and these are just counted. So you calculate them by counting the medication and also the liquid medications has to be put in a measuring cup to know for to determine the quantity. For the ocular, oral, and intranasal, you just need to follow the care plan, which will be written in the medication chart. So these are drops, ointments, and the doc's instruction will be given by the health practitioner. Inhalants and nebulizer, these are expressed in puffs and metered doses, which will be instructed by the practitioner as one puff or a certain metered dose. We have the rectal or suppository. These are enemas, and enemas are used to release fluids from it. Sorry, enemas are, not devices, they're medications used to release fluids into the lower bowels. They all come in capsules or in liquid form. We have subcutaneous injections. These are notes or well, note that this is self-administered most of the time, or can be administered by qualified health practitioners, um, mostly registered nurses. These are yes, not to go into further details, but these are usually given by registered nurses and they're given in something called units. Topical medication, transdermal medications, these are expressed per patch when using transdermal, and there are also lotions, creams, and ointments, which can be expressed as fingertip units. Prepare medications according to delegated role and relevant guidance. Organization requirements include doing a task within role responsibilities. This involves following the delegating health practitioner's instructions. We have legal requirements. This stipulates that the support workers uphold the client's rights, which must always be respected regardless of the medication's administration stage. We also have the environmental guidelines. These are implemented to ensure that the infection control procedures are applied to maintain a clean and sanitary environment. Just going to skip the case study. So what have we learned today? We've learned everything discussed in the um, in the presentation objective. So we've gone through and we've learned how to confirm delegating health practitioners authority. We've also learned how to clarify our role and limitations in administering medication administration with the delegating health professionals. We've also learned how to check equipment, ensuring that they're complete, ready for use, up to date, and also tamper free before administering the medication. We've also talked about infection control procedures as well as medication administration route and procedures. We've also talked about the purpose and functions of prescribed medication from care plans and delegating health practitioners, and also accurately calculating medication dose using the appropriate units as well as well, units according to the authorized documented request, so according to the medication chart, and also how to prepare medications according to the delegated role in line with legal and environmental guidelines. What to do next? You have to complete your e-learning for chapter 3 and 4, and you also have to complete the question 11 to 20 of your knowledge questions. Thank you so much for listening. Bye bye.